Hi, hi. My name is Rose Inyama. This is my showcase poster of my time as an ARC GM intern 2023 2024. And it's a reflection of my journey in pursuit of improving my research skills. So my journey starts with the first, this chart which I've done more like with arrows, an arrow in the middle going in a clockwise way within this chart because it just shows my journey, and I've tried to divide it into 4 segments. So the first segment is what I have called my comfort zone. So this is where I feel very safe. It's where I find myself as a senior clinical pharmacist working in general practice, where I find myself comfortable because I'm doing what I know best to do as a clinical pharmacist working in general practice. I carry out structured medication reviews and reviews of people with long-term conditions. So I review their medications just to make sure the medications are safe and that they are getting the right treatment at the right doses at the right time. And just to make sure that they're not having any unwanted side effects or any adverse reactions from their medication. So I also carry out what we call medicines reconciliation. So when people have been in hospital and have been discharged, or when they have been in touch with a specialist in secondary care, any other clinician, and we get letters, clinical letters sent to us in general practice, and we look at the letters and complete the medicines reconciliation. So if there have been new medication started, it's an opportunity to start the medication, or if they have stopped any medication, we stop the medication in general practice just to make sure that their medication history is up to date and the patients are counseled to make sure they are getting the right benefit from the treatment. I do a lot of audits, quality improvement audits, service improvement audits as well, and patient safety audits just to make sure it's part of our job to make sure that patients are safe, the quality of the service we're providing is good, so they're always learning that can be done and improvements as we reflect on the audit outcomes. So that is my comfort zone. I also, alongside my daily job, I'm a foundation trainee, a mentor or tutor. So when pharmacy students have finished their degree and they're having their GP rotation, they come to general practice. So I usually have them for about 13 weeks each year, where I teach them, I mentor them. I also teach when the third year or second year pharmacy students from Manchester University come for their half a day placement. I take on some of them and teach them as well. I'm also a mentor for when people join the team. I support them during the induction. I also support the ones I line manage. I support pharmacy technicians as well joining the team. So this is my comfort zone, and this is what my day like it looks like um, within the area where I work in general practice. And then the arrow moves me from my comfort zone to my fear zone. So this is where I try to confront my fears. Um, I try to improve my confidence because I don't really have much research skills. And as a result, I applied twice for the NIHR pre-doc fellowship. And on both occasions, my application was declined. And it was an opportunity after the decline of my second application. I was offered the ACGM internship, which I accepted. And my first meeting with my supervisor, who is quite lovely, Dr. Penny Lewis, started with the skills audit, which I found very, very helpful because with the skills audit, it was trying to find where my learning needs were and where we could agree certain tasks or activities that could help me to improve my research experience or my research skills. And following on from my fear zone, I moved on to the learning zone, which most of it happened during the internship period, So I was given the opportunity to be enrolled into the research methods module, which was quite good because it exposed me to know the kind of research um, to apply to the research method to apply to answer my research question, whether it was going to be a qualitative study or a quantitative study. It also exposed me to learn about data collection, data handling, and data interpretation. And it was quite a valuable experience because I've been able to understand these processes a bit more. I also was involved in an activity, rapid review, which was a process of reading through papers that have already been selected based on a search. I didn't build a search, so the search had already been built, and the papers had been selected to be reviewed to address a particular concept. So trying to, in this particular case, it was trying to address a concept of the effects of different relationships between clinicians interworking and things that could help it or things that could improve it. And I found with the rapid review, it was an opportunity because I'd never known about the MMAT, the appraisal tool. So being able to use this tool as I looked at these papers to be able to extract the information into the Excel sheet, it was an experience that I was very happy to be part of. And I'm thankful that my supervisor, Dr. Penny, introduced me to this process. Also, during my year as an intern, I got the opportunity to interact with some other researchers at different stages in their career and to be able to glean from their experience and to get some feedback off them on how I can improve my research experience too. So I'm thankful for the opportunity to network, and that has helped me to move on. I'm still in my learning phase, but to move on, decide to move into my growth zone. So the growth zone is where I have decided to face my challenges, and I've decided to pursue my ambitions, to pursue my dreams, and to also pursue my goals. And for this reason, I have applied for the PhD at the University of Manchester, and I'm hoping that my application this time will be successful. But the journey continues, and it's been from one stage to another. And I want to use this opportunity to thank everybody at the ARC GM for the opportunity to be an intern. I want to thank especially Dr. Penny Lewis for being a very great supervisor. She's been there to guide me, to direct me, and to listen to me, to correct me when I do err, because I started as a research novice, not really knowing what to do, but she's been able to guide me and to signpost me to different places where I could get more information from. Thank you very much for the opportunity. Thanks for listening and for the poster. And I will appreciate any feedback going forwards. And thanks again for listening.